All right, I'm glad you're still with us here on Morning at NTV. Time to take note, and we need to further dig and understand the burden of obstetric fistula on the country. Yesterday, we had a conversation with stakeholders, including an official from the Terrawode Community Hospital in Soroti, who is, of course, engaged in interventions that do help the women who are grappling and suffering from fistula. Today, we are joined by Dr. Rony Bahatungire, a Commissioner of Clinical Services at the Ministry of Health. This, of course, is part of ongoing effort to ensure that the commemoration of the Fistula Day is hammered down, as well as what's going to be happening in the run-up to the 29th of May, when the national commemorations will be held in Namaingo District. Many thanks for joining us, Doctor.
Thank you so much.
How are you doing? First and foremost, like I said, we had a conversation yesterday, and I want to understand, in light of the Ministry of Health, there is a whole week, should be, of preparations ahead of the commemorations of yesterday that will be held on the 29th. Just tell us what the planning is, but what the Ministry of Health intends to address specifically this year.
The Ministry of Health, thank you so much, moderator. There's so many interventions that we've been undertaking throughout the whole entire campaign, and maybe just to bring to the fore, as a ministry and as a country, we always join the world to commemorate the International Day to End Obstetric Fistula, which is usually commemorated on the 23rd of every May. However, as a country, we chose to have this commemorated on the 29th of May rather than the 23rd. And this is usually a day that we use to mobilize the population to raise awareness about this birth challenge or birth-related complication, so that we may aim at reducing the burden of female genital fistula. I will change a little bit from obstetric fistula alone to female genital fistula. Because the classification of the fistula is dependent upon the cause of the fistula. So when you group them up all together, they become female genital fistula. So our interventions, our efforts are all aimed at making sure that we prevent any new occurrences, any new cases that are going to appear as a result of the several causes that we shall be able to highlight at a later time. What
is the burden to the country right now when it comes to female genital fistula, in light of the fact that there are other causes than obstetric in nature?
Currently, when you look at the population of Uganda, when you look at women in the reproductive age group, about 1% of those are at risk or are actually currently living with obstetric fistula, and that may push the number up to about 100,000 of women that are in the reproductive, 100,000 of women in the reproductive age group that are living with obstetric fistula. When you compare this with the global burden, which is estimated at about 2 million people, that is a very big contribution. It may seem small, but when you look at the interventions that are required to put right this birth injury, it's rather a very challenging condition that we all aim at ensuring that we reduce.
Now, somebody out there will be bothered to understand, after a woman has cured from fistula, and then what's life after? For example, after you've suffered, a woman has suffered fistula, do they still have the chance to, I don't know even how to put this, but you are the medical person. It's also part of the burden on the lives of the women and those around them. What is life after fistula?
Thank you so much for that question. Before we discuss the life after, it's important for us to know what exactly happens in the lives of these people when they actually are suffering from obstetric fistula. Many a time, because they have uncontrolled leakage of either urine or stool, uncontrolled continuous leakage of urine or stool through their reproductive system. That means at all times they will either be smelling urine or they'll be smelling feces or stool, or they'll be smelling both. And that means that one, they cannot be tolerated in the community where they should be staying. Two, their partners may not be able to tolerate them, except a few that may understand how exactly this condition occurred, and they are in position to support these women through. So many a time you'll find these women living as destitutes when they've been cast out of society, and many of them will be living in broken marriages because their partners could not contain the whole entire event around their being, and this causes a lot of mental health challenges. And thereafter, when these women are finally repaired, the first thing that we need to work around is ensuring that their mental health status is restored, their esteem is restored, and this at large ensures that they are eventually reintegrated back into their social networks or social status. And the reintegration does not only stop at just having them accepted back in the community.
It's a continuous process.
Exactly. You have to do a lot of mental health and psychosocial support to ensure that they are fully reintegrated back into the social structures of the community. Many of them, you'll find that they lost their livelihoods when they stayed in broken marriages, and that means you need to be in position.
Job.
Exactly.
They are unable to do labors, including digging, especially in the rural areas.
Exactly.
That impacts on their productivity.
Exactly. So that means that they will have to be supported to get back onto their feet. And once they have been supported to get back on their feet, the first and critical element that we always advise unto these survivors is to ensure that they delay the time between the recovery and when exactly they can conceive again. The question is, can they conceive again? The answer is yes. But that is dependent on what exactly transpired during the whole entire birthing process that led to this fistula. Some women or some mothers, because of the complications of obstruction or obstructed labor, they come when their uteruses are ruptured, and in a bid to arrest the bleeding or to save the mother's life, you need to find a mechanism of how you can expeditiously stop that bleeding so that you can save the mother. And many a time, the intervention has been taking out their uteruses. So
as the only option.
Exactly. So now when you take out the uterus, then that means that person can no longer bear children. But for those that can bear children, for those that had fistula at different levels and their uteruses are intact, yes, we encourage them to delay that interval between the repair or when the injury happened, when the repair happened, and when next they can be able to conceive again. And that's the reason why contraception use is very critical during that period of time. So this is part of the package that we offer unto these mothers during the whole entire recovery period.
For a lot of empowerment for a woman who has been lucky enough to be repaired. I don't know how they go about convincing a man who has been there and has accepted that condition to be able to delay. And that's also a challenge, but that's psychosocial. Now, when you talk about support services across the country, I understood yesterday that we only have one specialized private operator, and that is the Terowodi Community Hospital in Soroti. I don't know whether this is something that is government and the Ministry of Health is comfortable with, that there's only one private operator. Isn't there a collaboration mechanism to assist those who might want to set up these facilities to be able to roll it out?
Thank you so very much. Fistula is not one of the things that we should be celebrating as a country. It's an indicator of poor obstetric care for the country. Yeah,
it's a damning assessment.
Exactly. So we should be aiming at ending it, rather than making or putting in place mechanisms to perpetuate it. So we
no, I don't understand that. Putting in place mechanisms to perpetuate it. I asked about the fact that are there collaborations to establish centers to deal with the condition?
That's what I'm coming to.
Is that perpetuating it?
That would be more like you're anticipating that many more cases are going to come up.
Come forth, yeah.
Exactly, which is an indication that you've considered that your healthcare system is that weak that it cannot address obstetric concerns timely so that you can prevent these events from occurring. Fistula, for goodness sake, is a preventable condition. And as a country, we have gone ahead and constituted a team of experts under the National Safe Motherhood Expert Committee that is putting in place mechanisms that aim at reducing or ending any preventable mortalities and morbidities that are associated to obstetric care. And therefore, we as a country cannot be pushing for establishment of such institutions. But what are we doing to ensure that we address those that have already occurred? As was indicated yesterday, we already have a collaboration as Minister of Health with Terewode Hospital in Soroti. But in the public structures, we have fistula repair services across the divide of all the regional referral hospitals. We have fistula repair services at the national referral hospitals, that is Mulago Specialized Women and Neonatal Hospital. We have fistula repair services at Kawempe National Referral Hospital, which is a facility that has been gazetted out for maternal and child health services specifically. And then this service also extends down to general hospitals, but then at Center Falls as well, this service has extended down in the form of what we call medical camps or fistula-specific camps that aim at attending or addressing the burden of that has already occurred. That means that as a country, what we should be doing is moving toward making this service a routine care service rather than creating facilities that are aiming at providing that affirmative action in a way that would mean that we are actually celebrating having fistula, which is a poor indicator of our healthcare services.
Wow, that is a case study of perception and everything that goes on in the formulation of some of these messages that the government may be undertaking. All right, I'm afraid time is not our best ally. Yes. In a minute, wrap it up for us. Any messages that we might have not taken care of?
Thank you so much, moderator. I would wish to indicate to the country and to the world out there that obstetric care is not only a mother's care or a women-specific undertaking. It takes two to ensure that we address this challenge.
And the men are
Let's ensure that the men are involved. But then as we call upon the men, we should appreciate that all of us as a population have a role to play in ensuring that we prevent and end this scourge of obstetric fistula. The local leaders have a role to ensure that each and every mother in their community attends antenatal care. The national leaders have to make sure that we have appropriated resources at a budget allocation to the Minister of Health to ensure that these services are extended up to the lower level health facilities. Recently, the Minister of Health, with the support from Minister of Public Service, approved new healthcare service structures, and these are required to be financed. So we would call upon the parliamentarians working together with the Minister of Finance to appropriate resources to the Minister of Health to be able to implement these resources, these interventions. And just to borrow a little more time, what we would wish to see is services extended closer to the people in ensuring that every mother that is out there and expectant receives what we call assisted skilled birth processes. A person should be able to deliver in the hospital so that we are able to prevent this challenge of obstetric fistula.
All right, thank you very much, Dr. Rony Bahatungire, Commissioner Clinical Services of the Minister of Health. You will not be charged any more interest on borrowed time.
Thank you, sir.